Welcome, I'm Tina Jennings. With this month being Breast Cancer Awareness Month, let's really have an open and real conversation. If you find yourself having to deal with any type of diagnosis when it comes to your breast health, you may feel overwhelmed and you'll need to know who to turn to. That is why the Breast Health Program at TMC has a team for you. Karen Narum is here to break down what we need to know and actually kind of keep us up to date with some of the latest information. Karen, I actually kind of want to start with one of them, which I feel like is kind of fluctuated in the news, maybe we're a little confused right now, but this is a perfect time to talk about mammograms. When should we actually be doing this screening and when should we end the screening?
Well, you're absolutely right. There's a lot of confusion.
Yeah.
At TMC, we stick with what I like to call the boots on the ground folks, the people who are working every day with breast cancer. That would be people in the college, American College of Surgeons, American College of Radiology. They really recommend that we offer an annual screening mammogram at the age of 40 and that we continue it annually. There is no magic number where that should be cut off. I know 75 is floating around out there. We need to treat people like individuals. At 75, if someone has a long list of health issues, if one of those things is more likely to cause their death in the next 5 years, then maybe a breast mammogram isn't something that's high on their list of things to do. But let's face it, there's a lot of vibrant 80-year-olds out there. We see them all the time, and getting an early mammogram we can cure cancer if we catch it early.
You know what, I love what you just said. We're going to treat everybody as an individual. You're right, every circumstance is going to be different. There's no magic number. Let's just do whatever is best for our health. And so that's why we're having these conversations this month, why it's so important to get that information out. And let's kind of talk about risk factors when it does come to breast cancer.
Well, I wish there was a magic number for that as well. We know that women, or anybody who has an Ashkenazi Jewish ancestry, is at an increased risk for a gene mutation. But when we look at all the women who are diagnosed with breast cancer, the vast majority of these ladies do not have any family history. When we check for genetic testing, only 5 to maybe 10% of them are actually found to have a mutation that may have added to them acquiring breast cancer. So really, one of my colleagues likes to say, if you're female and you have breasts, you're at risk. But we know as we get older, our risk goes up. There are other lifestyle habits. If you're overweight and smoking, just like for other health issues, we know that those can be factors as well. But the bottom line is we can't pinpoint all of those things exactly. So again, our best efforts are in trying to find it early, and that's with early screening.
I think a lot of people do kind of say that. It's not going to happen to me. It doesn't run in my family, or it's not whatever. I love that we make that blanket statement. If you're a woman and you have breast, you should be paying attention to what we're saying right now. And I know, like what you're saying, we kind of want to stay up to date with information. I've heard a lot about this 3D mammograms that are out there, and we're talking about that early detection and how important that is. Kind of tell me a little bit more about that.
So I was kind of the nerd on the tomosynthesis, which is what 3D is. I've been saying that word for a few years, and it's finally come. Most of the centers here in Arizona have that. 3D is another way of looking at the breast tissue. 2D is the standard where the tissue is compressed against each other. So especially for our women who have dense tissue, they may have these densities that are compressed against each other, and it's hard to see through those areas. The 3D allows the physician, it takes little slice images, so it allows the physician to actually look at the breast in layers. So we can layer the breast together. If there's densities there, it's going to help us find a cancer that's hidden in those densities, but it's also going to help decrease false readings. A lot of times dense tissue will be superimposed on each other in a 2D, and patients are called back for something that ends up being normal. So the 3D is very helpful in that.
I think with the technology growing, this is only helping, like you said, a lot of those false, readings that we had. That's a scare nobody wants, and we want to try to be as accurate as possible. But I also think that maybe people are also going back to that, being a little confused or getting some misinformation. What about when it comes to radiation exposure? When it comes to this, I think some people have maybe gotten some information that maybe have scared them a little bit.
Exactly. I don't think a lot of folks realize that just living our daily lives, we're exposed to radiation. You want to avoid it when you can, but people that live in higher altitudes, so people in Colorado, are going to be exposed to it more in their daily lives. A mammogram, I asked the physicist about this, and he told me it was equivalent to a coast-to-coast airline flight. So if you flew from LA to New York City, you'd be exposed to the same amount of radiation you're getting from a mammogram. And let's face it, folks get on airplanes all day long and don't think about it. So everything is a risk versus the benefit. And we still feel that the risk of the radiation from a mammogram is so small that our benefit in finding cancer early outweighs that.
Absolutely, I couldn't agree more. I want to leave with everybody with one thing. What kind of breast changes that I go through should I be paying attention to, and should I definitely be telling my doctor about that I've noticed? Because of course, you know, we again hear all of these things, but I want to know, I want to leave everybody with what are those very specific things.
I tell my patients, get to know the neighborhood. If something looks different when you're looking in the mirror, obviously if there's a change in the way the tissue looks, if one breast is bigger than it used to be, we call it self-breast awareness, but you can't have awareness if you're not doing exams once in a while. So if you come across something that just doesn't seem to fit in with the tissue around it, we want you to bring that to our attention. We believe you, we'll check on it. I'd rather have patients come 1,000,000 times and have it be nothing than miss that one time. Another misnomer is that breast cancer does not have to hurt. In most cases it doesn't. So again, just having that awareness is going to help us prevent this disease from causing any more deaths.
Well, ladies, get to know your neighborhood. That's what we're saying. Make sure that you know what we should be seeing, and if there are any changes, like you said, I'd rather them say 1,000,000 times that something is different and not miss that one time where it actually meant something. So thank you so much for coming. I love this open conversation that we're having this month about a lot of different things, but I'm going to remind everybody how they can get a hold of that wonderful team over at TMC. So thank you again.
Thank you.
Oh, absolutely. For more information about the TMC For Women Breast Health Program, call 324-BREAST. That's 324-2778, or log on to tmcaz.com/breast-cancer.